Hi, my name is Rick Bemis. I'm the Chief Data Officer for the Ksquare Group. We're a services company with accelerated software packages that help customers get their solutions faster and quicker. One of the most significant challenges in managing provider data is consistency. Consistency between all the different systems and changes that occur within that consistency and notification of that consistency. One of the things is reconciliation of claims at the end of the year. So when you overpay a doctor, they're obligated by law to pay it back to the payers. And if you don't have consistent information, you're not able to reclaim that data either. Well, I think it's actually ensuring that the quality of information is there, and there's several layers of quality that needs to be checked. Primary source validations, changes across the different type of landscapes with respect to the data, and how that all comes together. And then looking and see how the data itself is measured by quality. We take a unique way of looking at the data and actually looking at the consistency of information across these different networks. And we give you that. We also give you the ability to see information in different networks too. So not only if it's in your network, we can see out-of-network providers. We also can see regionally what's going on. We take classifications from NCUU and the taxonomy, and we pull that in so you can see the right skill in the right place at the right time. Yeah, so the efficiencies in providing care to the patient of having proper data at the right time can be maybe boiled down to people looking for a particular physician for an encounter to be seen, and when they drive up to the encounter, they find it's the wrong address at the wrong place at the wrong time. So you can imagine when you're thinking you have an appointment, how scattered you could be, not only because you have a health problem, but you're just not at the right place. So even the simple thing of address is something really important. Not only that, we want to make sure that the doctor has the proper training and the proper skill to be able to service your needs. So when we incorporate that into the directory, we make sure that they are credentialed properly and that the doctor is actually skilled and trained to do the service for your need. Some of the common sources of error have to do, like I just mentioned, in address, but also with respect to the proper type of cultural needs based on those particular physicians. So sometimes language barriers could be a problem with respect to having the right doctor in the right place. We look at those particular type of skills and make sure that culturally they align with the people seeking care. So if somebody, in some sense, we have an example where somebody's looking for Spanish, but not just regular Spanish, Catalonian Spanish, which is a very unique Spanish. So you give the patient more comfort when they have a doctor who can speak with them on their level, based on their language, based on their culture. That's a great question. The interoperability of provider data systems across different networks and different sources really, to us, from a governance perspective, is kind of jumping the gun a bit. What people need to do, and providers and folks in the healthcare industry, is to know that they have to get to a foundational point of understanding their information, then look at the coexistent type of properties in that to get to the point of interoperability. We're able to communicate across to these different places, the proper places, but it goes beyond just interoperability. So sustainability of this type of interoperability needs to be carried out also. So we can say we're interoperable, but do we continue the interoperability, and what kind of sustainability on that interoperability do we have? What are the demands on provider data management is really the demand of accuracy. And accuracy not only just being from the fact that I can find the right address, but the right skill set and the proper training. There's also two kind of intricacies around, predefined specialties, but also an extended specialty. Like today, we're dealing with the specialty for street medicine. There's no taxonomy in that, but it's a necessary need for us to help the homeless people in underserved communities. So street medicine is something that's not listed, yet it's cascaded based on the way taxonomies are aligned. Cybersecurity and provider data is definitely an issue because we don't want people coming in and misrepresenting themselves as a doctor based on getting into systems and saying, hey, I'm Dr. Joe Blow. We've all experienced this in social media where we've had some form of misrepresentation of our accounts. So to do that with a physician would be paramount to just fraud and a way of actually trying to maybe garner more compensation or misrepresent the medical industry altogether. Data validation in the provider space is primary source validations. Not only that, periodic credentialing of the data. In other words, ensuring that the doctor has the proper data at the proper time and making sure you follow up under those periodic periods that you have the data and it's accurate. So doctors can go into MPES anytime and change their data. And if they do that, they don't really alert anybody that that change has occurred. So these systems must be able to go out and do periodic checks of primary source validations, bring back the deltas, and then also share that with folks. The additional thing too is that consistency across directories also is inconsistent too. And if you have somebody who's breaking in and misrepresenting somebody, then it may change it across the whole network system, the whole ecosystem, which is really not good. Yeah, the Provider Genie is our generative AI component that allows you to interact with a report, a graph report that shows you multiple dimensions of the data and also allows you to talk to OpenAI and get information back from OpenAI that helps create guardrails and actually gives you a broader perspective of care. We use Provider Genie today for diagnosis where somebody has a symptom. Like for example, if they have depression, we'll ask the Genie, can I get, what do I do for depression? The Genie will come back and give you a set of doctors that would align themselves, psychologists, psychiatrists, or whatever taxonomy. You can do the same thing with any kind of, like if you have foot sores or something of that nature, maybe you have neuropathy and we'll come back with a physician that can support that too. Not only do we come back with a physician that supports it, we give you a spectrum of support that you can have and skills of the doctors that allow you to select each one and then continue on to trying to find the right doctor for the right condition at the right place.